they will have the next our defense, and then we have the quorum of the dissertation council meeting at the Al Farabi Kazakh National University for the group of specialty 6D 0740 00 and 8D 07 113 nanomaterials and nanotechnology in chemistry, and the 6D 07 34 00 8D 07 1103 chemical technology, explosives and pyrotechnics for December of 14 2022. At the meeting of the dissertation council, there are 4 permanent members of the council out of 5, and 5 temporary members of the council out of 5. And is absent secretary of the council, Mervat Najib Khaza, because she is in an official, urgent official business trip. It's by order, and her duty will be performed by the deputy chairman, Professor Ongarbayev Yerdos. And there is a proposal to start the work of the dissertation council. And is there any objections? Yeah. There is no objections. Then the meeting of the dissertation council is announced as open. Everyone has again agenda. On the agenda, the defense of the dissertation of doctoral student of Al Farabi Kazakh National University, Mohammed Shams, on the following topic: synthesis of the hydroxyapatite nanofibers for targeted drug delivery, on the specialty 8D 07113 nanomaterials and nanotechnologies in chemistry, presented for the degree of
У всех зависло, уважаемые коллеги?
Здравствуйте.
Да, зависло.
Здравствуйте, да.
Да, несколько секунд все висело.
Нет звука. Нет звука.
А,
Председатель сейчас опять подключается.
мгм. Хорошо, хорошо. Спасибо.
Okay, so sorry, colleagues, I was dropped out and there was some technical problems. Again, we can continue or start again.
Continue.
Okay, start this. I thought I was stopped. The scientific advisors: Mansour Zuhair Ahmedovich, Doctor of Chemical Sciences, Professor of Al-Farabi National University, Almaty, Kazakhstan, and the second advisor, Masoud Salavati Niasari, Doctor of Chemical Sciences, Professor of University of Kashan, Iran. Official reviewers: Rinat Iskakov, Doctor of Chemical Sciences, Department of Chemical and Biochemical Engineering, Professor of Sakayev University, Almaty. And the second one is Almagul Macharipova, Doctor of Medical Sciences, Department of Scientific and Clinical Work, Kazakh Russian Medical University, Almaty. The presented reviewers are also presented here. The dissertation work is presented for the defense for the first time. Everyone has the materials on dissertation. Are there any comments on the agenda? There are no comments. Then the agenda is approved. The floor is given to the Deputy Academic Secretary, to Professor Erdos Ongarbayev, to announce the documents available in the applicant's personal file. Please, Erdos Ongarbayev, floor is yours.
Mohammed Shams was born on 1992, January 8th January, after graduating with a bachelor's degree in the specialty Engineering Technology of Chemical Industry during the period 2009-2013 at the Faculty of Chemical Engineering of Islamic Azad University. He entered the master's degree in the specialty Nanoscience and Nanotechnology, Nanochemistry at the mentioned university. He started his PhD from January 2020 to December 2022 at the Al-Farabi Kazakh National University in the specialty Nanomaterials and Nanotechnologies in Chemistry. According to the plan of scientific internships, Mohammed Shams conducted research work at the Institute of Nanoscience and Nanotechnology, University of Kashan, Iran, on the topic of his dissertation from September to November 2021. The topic of the thesis of Shams is synthesis of hydroxyapatite nanofibers for targeted drug delivery, and it was approved by the Scientific Council of the Faculty of Chemistry and Chemical Technology of Al-Farabi Kazakh National University on 12 February 2020, protocol number 2. Scientific consultants, Professor of Al-Farabi Kazakh National University, Mansour Zulkhair Muhamedovich, Foreign Scientific Supervisor, Masoud Salavati Niasari, Professor of Inorganic Chemistry at the University of Kashan, Iran. Major scientific results of the dissertation are published in authorship in 7 manuscripts, including 3 articles in scientific journals with impact factors in the Scopus database. 4 manuscripts are presented in proceedings of international scientific conferences and symposium. The personal file of Shams contains copies of diplomas of the bachelor's and master's degrees, a list and copies of publications, transcripts, positive reviews of scientific advisors, the conclusion of the department on the thesis, and all other documents in accordance with the provisions of Committee for Control in the Field of Science and Higher Education of Ministry of the Republic of Kazakhstan. Mohammed Shams has passed the state examination on the excellent assessment, finishing his study on the PhD doctorate. The dissertation of Mohammed Shams was discussed at the extended meeting of the Department of Chemical Physics and Material Science. The meeting was attended by 28 people. Satisfactory answers were given to all questions and comments of the reviewers. Therefore, a scientific seminar recommended that dissertation for the defense. Extract from the protocol number 21 of September 9th, 2022 was approved by Tasibek, the Vice Rector of Al-Farabi Kazakh National University on Scientific and Innovative Activity. The speech of the scientific, the Date of the defense and names of official reviewers were appointed at the meeting of Dissertation Council on 3rd of November 2022, protocol number 22.
Thank you, Yildiz Sham. Are there any questions to the Deputy Scientific Secretary or doctoral student applicant? No questions. Yeah. The floor is given to the applicant, Mohammed Shams, to present the content of the thesis for up to 20 minutes. Please, Mohammed Shams, the floor is yours. You have up to 20 minutes for the report.
Hello, everyone. It's my honor to have you all, dear professors, here. I'm Mohammed Shams, third-year PhD student of Al-Farabi Kazakh National University in field of nanomaterial and nanotechnologies in chemistry. My supervisors are Professor Zulkhair Mansurov from Al-Farabi Kazakh National University and Professor Masoud Salavatinia from Kashan University in Iran. Can you see the presentation right now?
It's uploading. Now it's okay, but there is some squares.
Squares?
Yeah, on the top. The gray squares. Yeah.
Let me reshare again.
Yeah, just close it and
Yeah.
open the presentation, then share it again.
Okay, sure.
Follow the word.
Is it okay now?
I see. What about you, colleagues?
Is it clear to everybody?
Now it gets small. Just enlarge it for full screen.
Is it okay?
Colleagues, what you say? What you see? You see what I see also? Yeah. Some.
Yes, some squares, black. Next slide, please. You can show.
Okay, I will go to next slide. Is it still? Are there still the squares?
Yes, here in the top on the right, some black square.
I don't have anything here. Maybe it's because of. Let me.
Please open your presentation. Start demonstration, then share it. Open presentation.
Okay.
Start demonstration, then share it.
Okay, sure. Is it clear now?
I see some three squares or in a different position. Yeah, now one was removed. You have removed one.
I don't know why they are appearing because there is nothing open in my computer, only my dissertation.
Yeah.
Может быть, сейчас нормально, и там пусть продолжит.
Okay, full screen, please.
Full screen?
Yeah, full screen.
Is it okay?
Yeah, it's good. Okay.
So can I start now?
Yeah.
Okay. the main topic of dissertation is synthesis of hydroxyapatite nanofibers for targeted drug delivery. The work involves obtaining hydroxyapatite-based biodegradable scaffolds and their application for bone regeneration. Hydroxyapatite and calcium pyrophosphate nanopowders were obtained from eggshell waste, and metallic nanosilicates as resin reinforcement precursors were synthesized using the sonochemical method. A biodegradable resin was prepared in which polylactic acid and polyurethane was used as the main matrix. Printed scaffolds, physicochemical, mechanical, and in vitro properties were studied. And as you know, bone fractures are a global public health issue. The biggest problem of bone diseases, especially osteoporosis, is a fracture, which may be the first patient's first visible sign of disease. Each year, an estimated 2 million individuals suffer of fracture only in the United States. And according to the data provided by the Institute for Health Metrics and Evaluation, globally, there were an average 53% increase in all kinds of fractures. And as you see here, Kazakhstan in both group of women's and men's is one of the countries which have the most fractures in the bone in the world. So this is a big problem for a country that should be addressed. In case when conventional method cannot repair bone fractures, bone scaffolds promise effective therapies. In conventional techniques, there is a change in structure and function by biological substitutes. And there is a need to remove some of the implanted materials after the treatment period. The impossibility of blood flow in the scaffolds are another problem, but these problems can be addressed and solved by 3D printed biodegradable scaffolds because of their porous structures and interconnected pore networks with proper size for efficient mass transports, including blood, oxygen, and nutrients. The aim of work is obtaining an optimal scaffold structure as the primary model with the biodegradable composition and suitable mechanical properties for medical application, and synthesizing a biodegradable resin with non-reinforcement precursors to enhance its mechanical and biological properties. For this, obtaining hydroxyapatite and calcium pyrophosphate from eggshells, developing optimal condition for synthesis, obtaining the optimal composition with bioactivity properties, and studying their physicochemical and physicochemical properties. And nanofibrous biologically soluble scaffolds as a drug delivery system by electrospinning, and achieving and developing an optimal model of TPMS and FGLS structures, and the study of their mechanical properties for various medical uses, and synthesizing a biodegradable UV cure resin that can be used in SLA 3D printers and nanometallic silicates as the reinforcement agent in our scaffolds. The main provisions for the defense are mechanical tests showed that the TPMS and FGLS structures have good resistance against the crushing and tension forces, beside improving efficient mass transport activities, and can be used as potential medical scaffolds. Result of different analyses showed the potential of nanomagnetic resin precursors to enhance osteogenesis, and printed scaffolds reinforced with the hydroxyapatite have the potential to decrease the period of convalescence compared to filling the fracture with hydroxyapatite. And the novelty of this research work is that developing several algorithms for parametric design of TPMS and FGMS structures from a unit cell, and using a simple and cheap sonochemical method to synthesize non-reinforcement additives, and synthesizing a UV cured reinforced biodegradable resin that can be used in standard SLA 3D printers. And physicochemical, mechanical, and in vitro studies of printed scaffolds showed the possibility of using them as a functional scaffold for bone surgery. What are bone scaffolds? The body's ability to repair damaged parts is limited by different factors. In case of severe injuries, any bone defect with critical size need external supports, and these supports are called scaffolds. And why we use 3D printing for printing the scaffolds? Because The difference between scaffolds made by 3D printers and traditional method like using mold is that the additive manufacturing, which means 3D printing, the shapes includes user-defined infill geometries, which replace the solid internal volume with a structural lattice known as infill that can make a platform for blood, nutrition, and oxygen to pass. And for sanitizing hydroxyapatite and calcium pyrophosphate, we used eggshell waste, that calcium carbonate for the with precipitation method, and the obtained hydroxyapatite and calcium pyrophosphate, both of them have the purity more than 94% according to the XRD analysis. And here you can see the reaction of obtaining hydroxyapatite and calcium pyrophosphate, both of them from eggshells. And as you can see here in the FESEM and XRD analysis of them, both the purity are 94.6 and 94.8%. And FESEM images of hydroxyapatite and calcium pyrophosphate shows that the average size of them is between 1 to 2 micron. And calcium pyrophosphate particles with a developed surface morphology and an average size of 2 to 3 micrometers. And according to the EDX analysis, the calcium to phosphate ratio is 1.5, which for medical uses should be between 0.5 to 2. And ours are 1.5, which is suitable for medical uses. And for obtaining fibers, we used electrospinning method, and dimethylformamide and polycaprolactone were used to prepare the polymer solution. Then hydroxyapatite nanopowders, hydroxyapatite powders added to the solution. The polymer mixture was stirred, and then the electrospinning performed at 25 degree in room temperature with 15 kilowatts the voltage value, and 0.5 milliliter per hour the feed rate. And for electrospinning of the PCl and hydroxyapatite fibers, to evaluate the drug release from them, we used amoxicillin, which is an antibacterial agent, and as the same as previous stage, but with a different with the feed rate. The feed rate this time was 0.5. All conditions were the same, so we add the amoxicillin powders to our solution and then perform the electrospinning. And the solution for electrospinning were prepared with different ratios and components to study their concentration effect on the scaffold final properties. And we found out that the experiment showed that an increase in polymer concentration of the solution leads to the formation of fibers with large diameter. As you can see here, we did a standard diffusion test in agar, and over a 4 weeks period, an increase in the fiber diameter from 100 to 300 nanometer results in the decrease of the total release of the antibiotic from 98% to 75%. So by increasing the diameter of nanofibers, we can see the decrease in the total release of antibiotics. We used here 2 types of bacterial culture, one aureus and the second one with Physalis, which these 2 we used amoxicillin because amoxicillin can treat these 2 kind effectively. And as a result of the test, significant inhabitation of the studied bacterial strains growth was revealed when exposed to the scaffold sample based on the polymer fibers containing amoxicillin and hydroxyapatite. Here you can see the SEM images of obtained fibers. The first one is PCl-based fibers. Second one is PCl-based fibers with the addition of hydroxyapatites. The third one with PCl-based fibers with the addition of hydroxyapatite and 5% of antibiotic, and the last one with 7% of antibiotic. Here you can see
Mohammed,
yeah.
your presentation is still in one slide.
First slide
No, electrospinning fibers.
still is here.
Yeah, it still is here.
Mm,
In
let's see.
11th, yeah.
Let me stop and reshare it. Now here you can see the graphs.
Yeah, its graph is okay.
Uh-huh. Uh,
Show it like this one, okay? If
Okay.
you enlarge it, there is some problem. Yeah,
Okay. The synthetic of amoxicillin real in percentage and quantitative term, you can see in both graph that over a 4 weeks observation period, the sample number 4 and sample number 3 are the best in releasing the drugs. And these samples are exactly the samples with 100 nanometer diameter of fibers, I mean. And as you can see in the 2 other samples, which have the average diameter of fibers 300 nanometers, the real is less than these 2. So after that, we did the synthesis of biodegradable resin. We used different materials. Irgecure 819 used as the initiator, and according to the several experiments that we conducted to investigate the compatible reactive diluent, as shown in the next table, I will show, and 3-ethylene glycol dimethylacrylate, also known as TEG-DMA, used as the diluent. The final biodegradable resin formulation was 37% of diluent, 62% oligomer, and 1% initiator, as you can see in the graph. And here you can see the TGA and DTG curves of a standard resin compared to the synthesized resin. We used a standard resin that we bought from the Anycubic company from China, and compared to our synthesized resin, you can see here in the graph B, the viscosity is compared to each other, and you can see they are so similar to each other. And for the 3D printing, the viscosity should be between 0.2 to 2. And so it's completely suitable for 3D printing. And the TGA and DTG curves shows that they are so similar to each other and suitable for works. And in the table, you can see that when we use TEG-DMA, why we choose TEG-DMA as the diluent, because we tested different materials, and this one had the best performance. And designing of scaffolds is done by Grasshopper plugin in Rhino 7 application. And as you know, an exact parameterized from defined by the Vistras formula, as shown in the in equation below. We used it, and here you can see the parametric design step of TPMS scaffolds using the Grasshopper plugin in Rhino 7, as I said, and their periodic trigonometric functions. Here you can see the steps, and as an example, the evaluation of gyroid surface from fundamental region to the cubic unit cell and final TPMS structures you can see. And mechanical properties of scaffolds, we did 2 types of mechanical test: compression test and tensile test. The importance of tensile loading in the fracture mechanism of bone has long been recognized. It has been demonstrated with brittle coating that most of fracture occur in tension, since bone is weak in tension. So we used tensile and compression tests. We in the for the test show that we printed the scaffolds in 2 groups. 2 groups of scaffold were printed. In the first group, 6 scaffold were printed using biodegradable resin, which is commercially available. And the second one with the using a mixture of biodegradable resin that we sanitized with 5% of hydroxyapatite and 5% of calcium pyrophosphate. We did the compression tests, and here you can see as an example compression tests on Schwartz P structure done by Universal Testing System. And as you can see here, the results show the reduction in the compression resistance by adding the resin precursors, and Kelvin lattice has been the most robust structures among the others. And in the tensile tests, gyroid lattice, gyroid structure was the best. And the experimental results confirm the decrease in the specific ultimate tensile strength as the infill percentage decreases. And in particular, the gyroid structure, the gyroid structure was more robust than the others. There is a direct relationship between the porosity and the tensile strength. With increasing the porosity, tensile strength decrease slightly, not so much, but slightly will decrease. And for solving this problem, we sanitized different resin reinforced precursors by sonochemical method, which is so cheap and a quick and cheap method. The nanometallic silicates were sanitized through the ultrasonic sonically accelerated method through the sonochemical procedure in the presence of TETA, triethylene tetramine, to improve the scaffold's mechanical properties. As you see, after adding the hydroxyapatite and calcium pyrophosphate, we have this problem. And giving them the osteogenesis properties. Why osteogenesis properties? I will explain in the next slide, but sonication mechanism, the function of ultrasonic dependent on the acoustic cavitation includes bubble formation, expansion, and the collapse of bubbles. As you can see in the figure below, after collapsing and expansion of a bubble, a microjet will appear, and this microjet can hit the surrounding and crash the particles to the nano size. And here you can see the XRD analysis of different nano silicates that we obtained, and all of them have the purity more than 90%. And here you can see the FESCM images of them. And the average size of them is 94 nanometer with developed surface morphology and minimum agglomeration. And we did the VSM analysis on them to know that their magnetic properties, because we use them to give the scaffolds mechanical strength and then osteogenesis properties. And according to the result, both samples are soft magnetic materials with high permeability and are easy to magnetize and demagnetize. According to the literature review, soft magnetic materials can enhance the osteogenesis process. And here you can see the BET analysis of them, our 3 sample, which their BET surface area, mean per diameter.
You have
Yeah.
out of your time, but there is a you stopped your presentation in 21.
Yeah. And the final compression test on the different structures with the addition of nano silicates, and finally soaking the scaffolds in the SPF solution, because the bone bonding ability of material is often evaluated by examining the ability of the apatite form on their surface. And most previous studies have focused on 2D structures, and previous studies confirmed that increasing the osteoblast adhesion and proliferation by soaking the scaffolds in SPF solution. As you can see here, the lidinoid structure was the best, and after that Schwartz P. And conclusion, it has found that the crystalline hydroxyapatite and calcium pyrophosphate obtained by the chemical precipitation method has the purity of 95%. And the obtained polymer-based fiber by electrospinning with the addition of hydroxyapatite are promising candidate for biological matrices and drug delivery agent. And by increasing the size from 100 to 300 nanometer, the total realize of the drug will decrease over a 4-week observation period, and TPMS and FGLS structures were designed based on various cell geometries. And the gyroid structure is the best in top load crash, and the lienoid structure is the best in the tensile tests. And producing resin reinforcement precursors by ultrasonic method lead to formation of nanomaterials with suitable size, morphology, and surface properties for medical application.
Show next slide.
And the publication we published the results in 3 Escopos paper, which one of them is for simulating the fluid flow in the structure. The second one is about the mechanical properties of each scaffolds, and the third one is about the nanofibers that we produced to carry the drug. Thanks for your attention.
Okay, Mohammed Shams, you are not hearing us because we say keep your presentation. Don't close it.
Okay, I will.
Yeah.
Open it.
Thank you, colleagues. Questions? Please, Marpek Turpelians, you was asking, yeah?
Do you see it?
Yes, thank you very much. Muhammad, please, one question I have. You said that when you increase polymer concentrations in your solutions, its effects leads to the increased diameters of your fibers.
Yeah.
And could you some examples for slide 13?
Slide 13.
Diameter of your in the first cases and the second cases diameters increase from
Increase the average size of the nanometer are between 100 and 300 nanometers, and by the increasing the concentration here, by increasing the polymer concentration of the solution leads to the formation with fibers with higher diameter. So we try to keep the concentration in optimal period, optimal range, to have the avoid the producing nanofibers with more than 300 nanometer diameter. Here you
300 nanometer, yes?
Yeah.
Increase from
300 is our maximum. 100 is between 80 to 100 is our optimal nanofibers.
Okay. Thank you.
You're welcome.
Thank you, colleagues. Another questions, please.
I also have got a few questions to Mohammed, if I may.
Please, yeah.
Mohammed, thank you very much for your presentation.
You're welcome.
Very informative. I don't have any questions regarding the synthesis and design of your system, because as I saw from your presentation, I think you comprehensively have studied the synthesis methods as well as the physicochemical properties of your system. But I was just wondering, what have you looked into the reproducibility of the properties, for example, size of your scaffolds and particles? I mean, in terms of your study, how many batches in total did you synthesize, and whether the properties and characteristics of these batches were reproducible?
If I understood your question correctly, you asked about the size of scaffolds, yeah?
I mean, how this size is reproducible. For example, if you repeat the exact same synthesis for a few times, will the characteristics and the size be reproducible? And how many batches of this product have you synthesized in total?
I can answer it in two different ways. First, for our scaffolds, and second, for the material that we used. First, for our scaffolds, the method that we used is the parametric method, which there is no need to redesign a scaffold from the batch, and there is no need to have a knowledge about 3D modeling. Just by changing the parameters, as you can see in the left below, just you can change the parameters and give the sizes that you need. And if the printer that you use have the ability to print, you can print it without any problem. It's the first. And for the second part, for the materials, for the material that we used sonochemical method for sonochemical method for resin precursors. The average size of them were 94 nanometer, but you can have control on the size with changing in the sonocation time and sonocation power. It's for the sonocation part, and for the synthesizing of hydroxyapatite and calcium pyrophosphate, you can have the control on the size by treatment, heat treatment after the synthesizing, treatment temperature and treatment time. If you keep the treatment temperature in 1100 for 3 hours, your average size will be 1 to 2 micrometer. But if you increase the temperature for 100 degree more, your size of material comes smaller and in the nano scale. But if you increase the temperature more, again, the agglomeration will occur and the size of particles will increase to the micrometer too.
Okay. Okay, thank you very much. I also have got a few questions on the methodology and application of your system. So as far as I understood from your presentation, you only tried loading amoxicillin and antibiotic drug, but have you thought into loading not only low molecular weight compounds, but maybe some stem cells or, for example, growth factors such as BMP2, which will be more beneficial for the bone and tissue regeneration than the antibiotic itself? Because if we conduct an open surgery, we perhaps can just take antibiotic systemically, which the duration of which will depend on the longevity of the surgery. So have you thought of these options?
No, we didn't start these options, but it's possible because we synthesize the nanofiber to carry different types of drugs and growth factors, as you said. But in the next stage, maybe in the postdoc, I will continue this. The main focus and the main aim of this work was to make a platform for bone scaffolds. So in the next stages, we can develop adding different drugs to our scaffolds and trying to use them first in the animals. It's one of the aim to continue and have experiments on the animals and load the scaffolds with different drugs, like as you said, or maybe growth factors too.
Thank you. And as you know, the whole area of bone and tissue regeneration, tissue engineering in general, is currently very trending. So what are the potential benefits of your particular system? Are those existing ones, for example, those that are currently in clinical studies, for example, heparin conjugated fibrinogen and other in situ gelling formulations? So those were proposed for clinical studies in South Korea. Those and similar systems are currently in clinical trials even in Kazakhstan. So what are the potential benefits of your scaffolds over in situ gelling formulations for tissue engineering?
The main difference between my scaffolds is that we used TPMS, which means triply periodic minimal surfaces, which are one kind of mathematical models. For the first time, NASA, the Space Agency of United States, used them in the body of shuttles because they are so light, and they have good strength, and their porosity can make it possible for the blood and nutrients to have the flow. In one article that we have with Dr. Cengiz Dolbayev, we try to simulate the fluid flow in the structures. And as you can see, the other scaffolds that are currently using are metallic solid, have metallic solid structure, and they are like nanofibers. These fibers or metallic solid structures block the flow of blood, the flow of nutrients and oxygens to cross. And but this one gives the ability to them. And in the second part, because we use biodegradable materials, these scaffolds, there is no need to remove from the body after a while, and they can be a part of bone and be like the natural bone, and there is no need to remove them. It's the main advantage of our scaffolds compared to the others.
Okay, I see. And speaking of these advantages, have you studied or have you thought into looking on into toxicity, biocompatibility? I did see you studied the biodegradability profiles of your scaffolds, but what about toxicity and biocompatibility, either in vitro or in vivo? Because you're proposing a biomedical device, and as you know, any biomedical technology has to go through a series of toxicity and biocompatibility studies before moving into anything clinical. So if you haven't done this, how would you see it?
Because I say it, because we used all the materials which are 100% biodegradable, and it's proved by the different articles which are published by the different institutes and universities. So you're right, to be certain and to the stage of implanting them in the body, I mean human body, it needs critical and serious experiments to know about their toxicity and to be sure about their toxicity 100%. And as I said, because our main focus was to make the platform, and we did two just in vitro tests, which one was the release of antibiotic, and the second one was the calcium deposition on the surface of the structures. We just did these two to be sure that they have the potential to be used in the human body, but for the real application in human body, yeah, you're right, it should be and pass the different exams and maybe in the next stages.
Okay, and perhaps as one of the potential steps for your study, in vivo studies, how would you design and how would you see the in vivo studies of this project?
I couldn't hear half of your question. Can you repeat, please?
Speaking of the future steps of your project, how would you design the in vivo studies?
In vivo studies, yeah. The first stage is that, as I said, these scaffolds are infill structure of the scaffolds. Infill, and the body of scaffolds have their different process. And you know, by implanting them in the body, you need at least two parts to connect these scaffolds to the bone. And they have their completely different stages, and they should have some parts and sites that can connected to the bones. For the next, I want to try to design these connection sites. And the second one is that I want to try using different printers which can print the biodegradable materials, because we use here the SLA printer, but if we can use a printer which can print the biodegradable materials directly, and there is no need to add our powders, add our additives to the resin, and you can even produce them cheaper and more effective. For the next stage, I'm trying to do that. And the other thing is that we are trying to have a coating step, powder coating step. We can coat our structures with nano powders, but we didn't did it in this project. But in the future, I think it can enhance the osteogenesis if we can coat our scaffolds with some materials like, for example, calcium pyrophosphate, bioceramics, I mean.
Okay. Are there any animal models that you are planning to work with before moving into clinical?
Yeah. Sure.
What kind of animal models?
It's better to because we have a limit here, and the limit is the 3D printers. We have a limit to the size of scaffolds that we can print. So it's better to be an animal in the size of like dog, in the femur bone of dog, for example. It can be great, but for the smaller animals like mouse, we need a more precious and a printer with more accurate printer. But for now, I prefer to do it on animals like dog with the big bone of them, like femur bone.
Okay. And speaking of the application, as far as I understood, you will be applying this system in the form of a powder, right? As you know, the bone fracture doesn't necessarily happen very evenly. So very often we end up with rough edges of these bone fractures. So in an open surgery, how would you apply your powder? And most importantly, how would you secure your system be sitting in one place in that particular bone fracture?
Yeah, I compared my system with using the powder.
Один человек только задает вопрос.
Зухай Клавиш, у вас микрофон.
Алло.
Хорошо, сейчас. Да, я понял.
Can I continue?
Yeah.
I compared my model and said that using these structures compared to using the powder and filling the fracture with powder will give us this advantage for fluid flow. Because using the powder, after a while, this powder will become like a solid cement, and they block the flow of nutrition and blood. So we didn't use the powders, but Dr. Cengiz Dolbayev used the powders in the rabbit teeth, and hydroxyapatite, hydroxyapatite powders, and their results were good, but because we didn't use the powder in the animal, I don't have any additional information about fixing the powder in the bone or teeth.
Okay, thank you.
Yes,
I apologize, I didn't know we are limited on the number of questions.
No, okay, thank you.
No, I
please,
guess
other
the council should moderate the question from
Right.
different,
thank you. Please, other questions?
Can I have one question?
Yeah, please.
Yeah. Can you explain the novelty of your thesis and the principal difference? Because you told you were asked for from the biological point of view, but because your specialty is the chemistry, so can you explain what is the difference, principal difference in comparison with studies of other scientists in chemical point of view?
Yeah. The first and the main one was the designing the platform. I mean, designing the scaffolds themselves. As I told, these scaffolds for the first time were designed to use in the shuttles, space shuttles, but we bring them to the medicine part. We are not the first one to bring them to the medical parts, but we can say that we are one of the first ones that we tried to use and design them by parametric modeling. As you know, the novelty is that if a patient goes to the hospital, there is no 3D modeler to design the scaffold according to the patient's fracture. So it needs 3D modeling knowledge. But with the platform that we made, just by changing some numbers and giving the dimensions, the final scaffolds is ready to print, and there is no need to have any additional information about that. And the second one is that we used different nano precursors to enhance the osteogenesis of our scaffolds, which I mean nanosilicates. Nanosilicates that we produced are soft magnetic materials. These soft magnetic materials can enhance the osteogenesis properties of our scaffolds according to the literature review. My second advisor, Professor Salawati Nia, is working in this field, and they published several articles on the effect of magnetic materials and magnetic fields on the osteogenesis, and the perspective of this field is so positive. And these are the two main differences of our work with the other scientific.
Thank you. Please, other questions, please.
I have a couple of questions.
Yeah, please.
So I have a question regarding porosity. If you studied porosity of your structures, and the second question is regarding the loading of your amoxicillin. As I understood, you tried to encapsulate amoxicillin. So what about the loading capacity of the drug and the loading efficiency, if you studied that?
Yeah. The first about the porosity, according to the literature review, the best porosity for the scaffolds is between 100 micrometer to 400 micrometer maximum, which ours was 400 micrometer. And by increasing the porosity, the mechanical strength of the scaffolds will decrease. And but they have this advantage that can allow the fluid flow to cross the scaffolds easily and better than the scaffolds with smaller porosity. And the other one was about the amoxicillin. Here you can see here. Here you can see we used 40 milligram loading of amoxicillin in our nanofibers, and in sample number 3 and 4, which the diameter of the nanofibers was around 100 nanometer. Around 98% of them released, and around 39 milligram of 40 milligram of drug released.
Okay, thank you. Please, colleagues.
I think you said like 100, 400 micrometers. Maybe
100 nanometer.
Micrometers is too big, I think. 400 micrometers.
For scaffolds. For scaffolds, you mean?
Okay, thank you. So you didn't study the loading efficiency, right?
Didn't study what? I can't hear you clearly. Can you hear me? Hello?
Please repeat your questions. He didn't hear. Yeah, I told you, Professor. You can repeat the questions because the applicant didn't hear it clearly.
Yes, now I can hear you. So my question is, so my question is regarding the loading efficiency. Could you please comment on the?
I think there is some problems. Please, other questions, colleagues?
Can I ask some questions?
Yeah, please.
So can you go back to your slide number 14, please? Oh, you are staying on this slide. So how you studied your drug release?
By the inhabitation zone of here you can see here. There is in the standard diffusion test in agar, there is a method to measure the release of the drug, which is the measuring the inhabitation zone. Here you can see in the plate with the bacterial culture of aureus, the growth of the inhabitation zone after 18 hours reached to 3.8 minus and plus 0.007 millimeter, and after 72 hours 3.8 minus and plus 0.2 0.14 millimeter. And for the plate with the bacterial culture of physalis, it was 4.5 millimeter after 18 hours, and after 72 hours, it's 5.3 millimeter.
Okay, so can you go back to release curves then?
Here.
Then I'm not quite clear why you don't have data points on your graphs. Also, why you don't have error bars, and also not quite clear how you converted the zones of inhibition to the milligrams or percentage of release.
Yeah, it has a standard by some calculation which is constant in a standard diffusion test in all of them, and by some calculation that you do, and it gives you a number in percent, and because of that we bring the mean drug release in percent, and we converted the percent to the milligram, and here you can see, yeah, as you know, as you said, I could bring it in bars too, but I thought maybe it's clear. The number 3 and 4, which the diameter was 100 millimeter, here you can see the around 98% of the number 4, which was PCL, MX, and hydroxyapatite, with 100 nanometer released, and after that number 3, which was PCL, hydroxyapatite, and PCL and MAX without hydroxyapatite, and it was around something like 90% of the drug released over 28 days.
Okay, but you still need to have data points because you don't have like a continuous measurements. So you should have data points, and you should have presented the
I agree with that.
error bars. Additionally, have you looked at into like working out the kinetical parameters of your release?
Kinetical parameters? No, we did this part of test in cooperation with the medical faculty, because I'm not working in field of medical. So we didn't study the different kinetical parameters. We just did the standard model of diffusion test, completely the standard one, not the other. We didn't examine or examine different parameters.
Okay, and the final question, what was the temperature of these experiments?
The temperature 25.
But then that's wrong temperature, because it's well below physiological temperature.
As I know the temperature, maybe it's different. I should take a look in the, because I didn't bring it here. I should take a look in the dissertation, yeah, maybe.
Okay,
but,
thank you.
Which is in my mind was 25.
Okay, thank you.
Okay, a couple of questions, and it's okay. Who didn't ask, please? Let me, Shams, open your 16th slide, please. Okay, 16. Yeah, here you see that the weight in the temperature. What you can say that the second sample, that this dropping to weight dropping, and then again.
Why it's dropping?
Yeah.
It's by the you know, we used resins, and resins by increasing the temperature, the resin will decomposite. And after that the result materials will have the how can I say, higher weight.
It's a differential form of the red plot. Just that's all.
Yeah.
Okay. And as one more question here, you told that you have obtained the fibers from starting someone say 100 nanometers to 300 nanometers. Yeah.
Yeah.
And have you checked the dependence, your properties on these sizes?
Yeah,
what can you say about it?
Yeah, we checked, and by increasing we have two types of effective parameters that we checked. First was the feed rate, and the second was the voltage of electrospinning. By increasing the voltage of electrospinning, the fibers with a higher size in the diameter will produce, and the optimum voltage was between 13 kilowatt to 16 kilowatt, and the best one was 15 kilowatt. Kilovolt, and the second one was the feed rate. Feed rate, we first started to 0.3 millimeter per hour, which was too loud. So we started to change and find out that 0.5 is the best and optimal one for mixing hydroxyapatite with amoxicillin, and 0.7 is only PCl with hydroxyapatite.
Okay,
PCl with hydroxyapatite.
Thank you. Colleagues, one more questions?
Mm-hmm.
Who wants to give a question? Okay, if not, I think that there was enough questions. Yeah, colleagues, the floor is given to the scientific advisors. Okay, the first scientific advisor, Professor Mansurov Abdulhamidovich. Professor Mansurov, floor is yours, please.
Okay, thank you. Dear member of Dissertation Council, many thanks for it is for very interesting discussion. I want to say about the Mohammed Shams dissertation work. Shams Mohammed is devoted to study of obtaining and using a biological compatible material in medicine, calcium hydroxyapatite, with the subsequent study of the physicochemical properties. In this research, doctoral student also obtained composite fumes from nano-sized polymer fibers and synthesized hub powder obtained by electrospin, which is the pulling of nano-sized fibers from solution under high electrical voltage. He passed foreign practice in University of Kashan under the Masoud Salavati. Shams Mohammed mastered modern methods of nanomaterials research at Al-Farabi Kazakh National University, and showed a true scientist preservation and independence. The main task of the Kazakh National University is development of the Republic of Kazakhstan. Therefore, his research can help the country's domestic production in the field of 3D printing woven scaffold. In parallel, the doctoral student used and actively developing technology 3D printing for designing and printing TPS and PGLs structure in the Institute of Combustion Problems in Almaty. The main provisions of the dissertation are reflected in 7 published works, including 3 articles in journals with a non-zero impact factor, including the Scopus database, as well as 3 abstracts in the materials of international and foreign scientific conferences. And his dissertation, according to the main features, the relevance of the problem, the novelty of the results obtained, their validity and reliability, the amount of research and practical significance, is a scientific work that has a promising direction for the development of the processes of obtaining and research nanomaterials in bone regeneration in general. And we now work with some medical specialists for the future. It's very interesting results, and the doctoral student deserves to be awarded a PhD degree in the specialty of nanomaterials and nanotechnology in chemistry. Many thanks, Mansurov.
Okay, thank you, Professor Masarov. The next review of international advisor is read by the Deputy Scientific Secretary, and it's just a task. Please, Yerdus Khalmaevich.
So the PhD candidate has studied the synthesis of different bioceramics, hydroxyapatite and calcium pyrophosphate to use in bone tissue regeneration. In parallel, he investigates the synthesizing of biodegradable resin and the resin reinforcement precursors using the sonochemical method, which shows the promise of using this method for obtaining biodegradable scaffolds for tissue engineering as osteogenesis enhancement agents. In addition, the physical, chemical, and mechanical properties of the obtained powders, surface morphology, phase analysis, specific surface area, and porosity were studied. The PhD candidate results shows that to address biological needs, achieving the required mechanical function and mass transport qualities, the developed parametric design algorithms can generate hierarchical porous structures and create these structures within arbitrary and complicated 3D anatomical geometries that result in porous scaffold with a controllable shape for distribution, size, and interconnectivity. Due to the links that can be established between the geometric features made possible by the developed algorithms, the model shape changes whenever a dimension value changes. These findings can reduce the cost of bone scaffold production and increase their reliability. Shams passed foreign practice at the University of Kashan, and in collaboration with the Institute of Nanoscience and Nanotechnology, during his internship, he gained good experience in synthesizing nanoparticles with soft magnetic properties. One of the main goals of medicine is to decrease the period of convalescence, therefore producing biodegradable scaffolds by 3D printing, which can absorb over time, can significantly change this field, and Shams could overcome all challenges with his perseverance and independence. In the dissertation work of Shams, various mechanical tests are done on models to ensure their strength under real conditions. For example, the calculations carried out by the doctoral student showed that the porosity of scaffolds accelerates the delivery of nutrients and grows cells and can release the drugs over time. The published articles can be mentioned as evidence of the high quality of the work done. The main provisions of the dissertation are reflected in 7 published works, including 3 articles in journals with a non-zero impact factor included in the Scopus database, as well as the 3 abstracts in the materials of international and foreign scientific conferences and symposiums. According to the main features, the relevance of the problems, the novelty of the results obtained, their validity and reliability, the amount of research and practical significance, the dissertation work of Shams, 3D printing of hydroxyapatite as a drug delivery agent in bone refining, submitted for the PhD degree, is a scientific work that has a promising direction for the development of the processes of obtaining and researching nanomaterials in bone regeneration in general. The doctoral student deserves to be awarded a PhD in the specialty nanomaterials and nanotechnologies in chemistry. Scientific supervisor, Professor Dr. Masoud Salavati Niasari, University of Kashan, Iran.
Yes, thank you, Professor Movaev. Now let's start the discussion. The floor is given to the first official reviewer, Rinat Iskakov, Doctor of Chemical Sciences. Please, Professor Iskakov.
Dear colleagues, members of the Dissertation Council, thank you very much for your attention. My review fully has been published several days ago at the website of the Dissertation Council, so everyone could look at any details on my assessment of Mohammed Shams' work. Right now, I would like to reflect, mark on the main advantages, challenges, and shortcomings of this work. In my opinion, I'm sorry for my voice, I am on remedial from flu. The topic of the thesis corresponds to the development of science and the governmental program. However, the work was carried out without any governmental framework. Concerning importance for science, the work makes a significant contribution to science, and its importance is well disclosed. In the case of the principle of independence, self-reliance level of the work is high, and it's devoted to hydroapatite-based biodegradable scaffolds and the application for the bone regeneration. So in the principle of internal unity, we see the relevance of the thesis was justified. The content of the thesis fully reflect the topic of the thesis, and purposes and objectives fully correspond to the work. So concerning the new solutions, the proposed by the applicant, there isn't an evaluated, but in a partial analysis, because in my opinion, practical results must be proven with a patent. So scientific novelty of the results and provisions completely new in the work. The dissertation conclusions also completely new. Concerning technical, technological, economical, management solution, they are partially new because without the patent, it's difficult to assess correctly economical and managerial effectiveness of the investigation. So main provision, the provision 1 is a mechanical test showed that triply periodic minimal surface and functionally graded lattice structure have good resistance against crushing and tension forces. Besides improving efficient mass transfer activities and can be used as a potential medical scaffold, fully proven. The second provision, as a results of different analysis, confirmed that nanomagnetic resin precursor enhanced osteogenesis. I think it's also proven. In the provision 3, printed scaffolds by 3D printing coated with hydroxyapatite could decrease the period of the covalences compared to filling the fracture with hydroapatite powder shown in the different work is also proven. So I think the practical value, in my suggestion, I mark as a partially new the optimal condition for manufacturing hydroxyapatite and calcium pyrophosphate from eggshells was determined, but an obtained powder must be approved maybe in some small scale or through the patenting. I have some shortcomings in the content and design of the dissertation. One of the important part, one of the important part to apply materials for biomedical purposes is biocompatible and biodegradable performances of this material. So the applicant didn't provide any data on either biocompatibility or biodegradation of the synthesized material, which is artificial. Is there any speculation on such potential performances just on the obtained scaffold? The second, the applicant postulates that prepared scaffolds can serve as a vehicle for delivering bioactive factors to manipulate cellular processes within the scaffold microenvironment, giving the confirmation by the figure 34, which is just a picture. However, in the figure 29, in the slide number 14, it demonstrates obviously the typical Fickian diffusion of the bioactive substances in the kinetics of drug release, and it's required additional explanation from applicant. So the third shortcoming, what is the reason the applicant didn't apply any results for patents such as is a new synthesized substituted hydroxyapatite or content of the composite or procedure for scaffold production and so on. So in the final in my decision, I support the award of PhD degree to Mohammed Shams. So it's over. Yeah.
Okay, thank you. The floor is given to the doctoral student Mohammed Shams to respond on the remarks of the reviewer. Please, Mohammed.
Yeah, thanks. Thanks for your comments, and I agree with your comments with all of them. And about the your comment on which figure you said that it's just a figure. I want to know and fix the issue. Professor Iskakov, can you hear me?
Yeah.
Which one you mentioned that it's just a figure? I want to. I was agree with all your comments, and I want to know that which part was.
It's in the figure 34 in your dissertation. You say so which is just a picture. So you speculate that the scaffold should serve as a vehicle for delivering bioactive factors. I didn't see any delivering, just thick and diffusion from the.
This picture was only to show the ability of the scaffolds, and now we didn't did any experiment on this, and this I hope that we can do it in the next steps of the projects, maybe in postdoc. Yeah, I agree with all your comments, and thanks for your comments.
Okay, Professor Iskakov, are you satisfied with the answers?
Okay.
Okay. The floor is given to the second official reviewer, Doctor of Medical Sciences, Almagul Mansharipova. Almagul Turovna, the floor is yours, please.
Добрый день, уважаемые коллеги. Разрешите представить отзыв на диссертационную работу Шамса Мухаммеда по специальности наноматериалы и нанотехнологии 8D-07-113. Диссертационная работа посвящена получению оптимальных наноструктур в качестве модели первичного каркаса и биоразлагаемой композиции для регенерации костной ткани для медицинских целей. Работа выполнена в инициативном порядке. Работа соответствует специальности наноматериалы и нанотехнологии. И сразу хочу сказать, что работа интересна именно для доклинической и, возможно, в будущем клинической практики. Полученные в результате диссертационного исследования синтез биоразлагаемой композиции, армированные полученные УФ-излучения, можно использовать в 3D-принтерах. Физико-химические, механические инвитро исследования полученных каркасов показали возможность их будущего использования в доклинической и, возможно, в клинической практике. Установлены основные закономерности синтеза, дизайна, 3D-печати матриксы. Определены технологические параметры разработанного метода. Работа вносит существенный вклад в науку в области наноматериалов и нанотехнологий. Представлены в диссертации результаты проводимых исследований, получены автором лично, в связи с чем считаю уровень самостоятельности достаточно высокий. Актуальность исследований диссертации обоснована. Результаты, полученные в рамках данной диссертации, могут быть предложены для изготовления объемных каркасов. Преимущество предлагаемого метода конструирования печати скафолда является в том, что они являются биоразлагаемыми. Задачи, поставленные в работе, полностью решены. Результаты обоснованы, поскольку все измерения проводились на калиброванных приборах стандартными методами. Часть исследования была выполнена в Институте нанонауки и нанотехнологий Кашанского университета в группе профессора Масуда Салавати Ниасари. Таким образом, работа выполнена как разработка биокаркасных оптимальных структур в качестве модели биоразлагаемого каркаса для, возможно, в будущем для регенерации костной ткани и после проведения тщательных доклинических и клинических исследований. Содержание диссертации в полном объеме отражает тему исследования. Работа содержит 3 раздела: литературный обзор, методы исследования и экспериментальные результаты и обсуждения. Диссертация представлена на 70 страницах, включает 42 рисунка, 15 таблиц и 12 формул. Диссертационные работы сформированы цели и задачи исследования. Они соответствуют теме диссертации. Все разделы и научные положения в данной диссертационной работе логично взаимосвязаны. Новизна заключается в получении биологического биоразлагаемого каркаса, которое является результатом посттермической обработки исходных материалов с гидроксиапатитом. Были получены разные частицы разных размеров, и они проверялись в разных экспериментах. Один из выводов о том, что биокаркас может способствовать выделению антибиотика, это является достаточно интересным. И как автор говорит, что он может снижать срок наблюдения до 4 недель восстановления костной ткани. Это положение необходимо проверить в дальнейшем доклинических и клинических испытаниях. Научные результаты положения являются новыми, что подтверждается 3 публикациями в рейтинговых научных журналах. Выводы диссертации составлены на основе полученных экспериментальных результатов, не вызывают сомнений в достоверности. Но в работе не показано, что подана заявка на патент. Технические и технологические решения являются полными и обоснованными. Все основные выводы, основанные с научной точки зрения, имеются экспериментальные доказательства, они обоснованы и сравнены с современными литературными данными. Все положения обоснованы в данной работе, но разработанный метод получения в дальнейшем должен использоваться для тщательных доклинических исследований. Положение подтверждается 3 публикациями в рейтинговых научных журналах. Результаты диссертационной работы получены с использованием современных методов и методик обработки и интерпретации данных с применением компьютерных технологий. Теоретические выводы взаимосвязаны, показаны закономерности, и они подтверждены экспериментальными исследованиями. Имеются ссылки на 115 источников. Они являются достаточными для литературного обзора. Диссертация имеет важное теоретическое значение. Разработанный метод может являться основой для проведения доклинических исследований по инженерии костной ткани. Научный уровень соответствует международным стандартам проведения исследований в данной области. Качество академического письма высокое, и диссертационная работа оформлена в соответствии с требованием, предъявляемыми диссертациями. Данные результаты представляют практический интерес, и они должны в дальнейшем использоваться до клинической практики. Результаты исследования рекомендованы для предложения в доклиническую практику. Данная работа соответствует требованиям по специальности наноматериалы и нанотехнологии. Спасибо за внимание.
Алмат, спасибо за замечание. Просто у нас докторант in English. Сможете ли вы вкратце замечание сказать на английском? First one is for patent. Shams, the first comment was that there was no patent. What's with this patent situation? And the others, Алматуллевна?
Уважаемые, можно я немножко сейчас добавлю? Дело в том, что я попросила его подойти ко мне лично, и все замечания, которые были мною сделаны по работе, он исправил. Поэтому та работа, которая была мне представлена уже в последний момент, там замечаний не было по работе.
Okay, Ildush Harmaish, have you got the review? Can you translate to Shams the comments?
На сайте тоже на русском языке рецензия, но здесь я замечаний не вижу. Здесь нет замечаний.
Okay, there was one comment, Mohammed Shams, that on the work there was no patents, and what's these patents you're planning? Okay.
Yeah, I plan to submit it for a patent, but for the patent we could do it, but we want to develop the connection sites of the scaffolds to the bone too. Then we can submit and apply for a patent. We plan to do it, but until now we are working on the connection sites of the scaffolds, which is another complicated work, because you know, the medical scaffolds are so complicated, and companies with thousands of personnel are working in this field, and doing this individually is a little time consuming. And we plan to do it, but first we should solve the connection site too.
Okay, thanks. Almatullah, have you satisfied with the answer?
Thank you.
Okay, thank you. Now, colleagues, we have finished and listened to the reviews of our official reviews. Colleagues, we are starting to discuss the work and the defense in general. And please, who would like to speak and say something related to the applicant and the defense status? Please, you are welcome. Who would like to start? Let's then start. I will start. The work is more comprehensive here. It's the results are very approved and approved in the international conference. The applicant, as you see itself, was prepared well, and his answers were very full. As you see, more detailed. Each answer, he answered for each question. We get more full questions. The work has a continuing and the future work and more interesting. Yeah, and as you with the defense, it was seen that the topic is very interesting. There was so discussions, the scientific discussions, well discussions. And but it can be get longer, but because that we have time limits, yeah, we have just asked more main questions, but still the open questions, but it's not the case. It will be for future works. And I will support the applicant and work itself. Thank you. Colleagues, who else, please?
I have some comments. Yes.
Yeah, please,
Dear colleagues, today our PhD student, Mohammed Shams, presented his dissertation work. This work is very actual, relevant for not only for nanotechnology and in biomedicine, and he showed his results on the effect of the nano size of his materials on the properties and characteristics of obtained materials, and we twice listened his in our seminar of our Institute of Combustion Problems and Department of Chemical Physics and Material Science, and he's very active, and he achieved a good results. He has a good publications, and I want to say that he also published a textbook with Mirvet Najikuza in English on nanotechnology, and today he showed as PhD doctorate not only as a good experimenter, but also he presented the results of mathematical modeling to choose the optimal geometry, to choose the optimal structure for bone tissue regeneration. And I think according to these results, according to the volume of his work, he corresponds to the PhD degree. Thanks.
Thank you. Who else? Anyone else wish to speak? Once more. Okay, the work was good enough, and is if anyone is satisfied, everyone, then let's proceed to the next stage. Is the voting. Okay, we need to hold a vote, colleagues. We are voting electronically. I remind you that we have several options for the result of voting, and we vote using our email addresses. Please, Yaroslav Maevич, you are welcome.
Коллеги, приступаем к электронному голосованию, онлайн-голосованию. Всем Мирvet Najikuza должна была выслать на электронную почту, а также вчера выслала на чат, общий чат по сегодняшней защите ссылку на голосование Survey Monkeys. Вы сможете нажать и там выбрать соответствующую категорию и проголосовать. Здесь голосуют все члены совета и также официальные рецензенты. То есть у нас 11 человек, да, сегодня получается?
Да, 11 человек.
Да. То есть 9 членов совета, 5 постоянных, 10 членов совета, 5 постоянных. 2 рецензента.
5 временных, да. Mirvet Najikuza
отсутствует, поэтому
2 рецензента.
2 рецензента. Прошу проголосовать, приступить к голосованию.
Коллеги, только голосуем с одного линка.
Коллеги все проголосовали? У меня выходит 10 человек пока.
Who didn't vote yet, please?
Коллеги, это вот, Олег Юрьевич, я не могу найти линк, почему-то ни на почте, ни в этом. У меня просто идет открытие конференции.
Сейчас, Олег Юрьевич, я вам скину.
Да, на почту или на... Вот,
Я вам на WhatsApp сейчас закину.
Вчера вечером мне тоже в чате скинул ссылку.
Олег Юрьевич, я вам на WhatsApp
Да,
закину.
я получил, все, голосую. Все, я отправил, сейчас вы должны получить.
Please, Yaroslav Match, you can show the result now.
Сейчас я проверяю. Да, все есть. Сейчас я... Здесь вот проголосовали результаты голосования. The decision of the dissertation council for the defense of the dissertation of Mohammed Shams on the specialty nanomaterials and technology voted 11 members of the dissertation council, and все проголосовали за присуждение степени доктора философии.
Okay, thank you.
Единогласно.
Thank you. The dissertation council for the group of specialty is a 6D 074000 and 8D 07113 nanomaterials and nanotechnology and chemistry, and the 6D 073400 8D 07103 chemical technology of explosives and pyrotechnics at Al-Farabi Kazakh National University awards Mohammed Shams the degree of Doctor of Philosophy, PhD, in specialty 8D 07113 nanomaterials and nanotechnology and chemistry. And my congratulations. And now the final speech of Mohammed Shams. Mohammed Shams, the floor is yours. Your conclusion, please.
Seriously, I can't hide my feeling, and I'm so happy to have this opportunity to continue my education in Kazakh National University, and I'm really so happy, and thanks to all professors who helped me and give me this opportunity to increase my knowledge in this field. And during these 3 years, they helped me in every field, in every situation, and backed up me. And thanks to everyone, and I'm really glad to have this opportunity to obtain my PhD from Al-Farabi Kazakh National University, which is one of the leading universities in the world. And it was my honor to be professor of higher master of students during these 3 years. And that's it. Thanks to all. Thanks.
Thank you, and my congratulations. Good luck, Shams. And colleagues, we have everything on the bench now. According to the regulation and rules, we need to accept the conclusion of the council on the work of Mohammed Shams. Let's start the discussion of the draft of conclusion of the dissertation council on the thesis of Mohammed Shams. The draft conclusion was sent to everyone and now is demonstrated. Please, are there any principal comments on this project of conclusion?
Можете сказать свои замечания на русском, чтобы, если...
Илюш, можно вот, где вот сокращения, то есть некоторые сокращения там сразу приведены, можно там их аббревиатуру расшифровать. Вот, где вот в актуальности TMH. Вот здесь вот хорошо написано, а вот ниже вот можете спросить? Вот все сокращения, да, которые не общепринятые, там у него сокращение присутствует перед вот этими, перед положениями, да, вот такие вот сокращения специфические. И министерство также нужно исправить. Внизу вот. Да,
В конце или...
Сейчас, после...
Ну, пока вот до министерства еще не дошли.
Да. Пожалуйста, коллеги. Here.
Коллеги, по пунктам есть вопросы, замечания, комментарии?
У вас по почте были высланы, посмотрите.
Мне кажется, вот этот третий пункт, он просто общими словами здесь написано.
Расширить чуть надо.
Да, именно связать с тематикой исследования, с названием диссертации, может быть, там, с целью.
Мне кажется, уже Thomson Reuters это не актуально, то, что, по-моему, она называется Clarivate Analytics Database. Надо
Да,
это
хорошо.
проверить. И там еще выше были числовые значения, там десятичная точка, наверное, она как-то выглядела, как будто это знак умножить. Вот где статистика.
Да, здесь.
Да, вот 33,4%, видимо, да, вот, да.
Point.
Угу.
А может, какую-нибудь статистику дать по поводу, что происходит в Казахстане, потому что в самом начале он говорит про то, что в США потребность высокая и так далее. Вообще нужно ли это указывать? В самом начале, где он указывает. Да,
Вот это, да?
да. Ну как-то к нашему тоже связать с нашей ситуацией.
С нашей реалией, да?
Да.
Надо сказать, что хотя бы в мире, потом, в частности, вот в Казахстане, хотя так.
Ну да, как-то, чтобы было связано. А то как будто там мы находимся в США.
Да, понятно.
Также по тексту там, где Республика Казахстан, где-то «з» ставится, где-то пропустили. Ну, нужно внимательно прочитать, чтобы было как-то одинаково. Of the
Да.
Republic Казахстан.
Где-то Republic заглавным, где-то там маленькими буквами.
Да. То есть, ну, это просто такая вещь, которая Казахстан будут обращать внимание, поэтому...
Ну и вообще, мне кажется, нужно
Правильно.
проверить, да, на перевод. Там в некоторых местах есть. Где-то я видела. Сейчас
Вот здесь
не
вот
вижу.
пятый пункт, безусловно, написано, вот The Republic, там маленькой буквой. Вот такие места.
инвитро, витро с большой буквы тоже надо с маленькой.
And also physico-chemical. Ну, надо, наверное, написать. Где-то через черточку написано, где-то вместе написано. Тоже такие вещи. Просто пройтись уже все свежим взглядом, чтобы он
И
пришел.
унифицировать, наверное, да?
Да, и унифицировать.
Да, и, наверное, еще раз надо проверить все это.
Да, все организации, там, министерства, в общем, там, потому что вот это было на основе старого, может быть, где-то остались там Министерство науки, МОН где-то. Здесь вот, например, опять поправлено, видите, да, Higher Education. Там МОН ушел.
Так, to award не with the degree, а to award the degree. With убрать надо, вот где в resolved пункте.
To award.
With убрать нужно.
Переходим к классификационным признакам, или у вас еще есть замечания?
Можно, наверное, классификационно, может быть, по этим нужно заново то чуть-чуть уже свежим взглядом взглянуть. Смотреть.
First, the character of the results of the thesis. 1.3. Colleagues.
Наверное, да.
Есть 1.3, 1.3.
1.3.
Second, the results are new.
Yeah.
The importance high.
High.
Connection of the topic with planned research. У него...
Initiative же у него был work.
Initiative.
Да, он, кажется, он же говорил, что это, да?
Ну, я как-то спрашивал, да, проекта нет.
В рамках никакого не участвовал уже в проекте.
Вообще должно быть не connection of the topic of the thesis, а relationship of the topic of the thesis. Connection — это как бы физическая
Да,
связь.
это физическое, так, relation — это отношение. Там. Relation, просто.
Relation, да. Или relationship.
Здесь 4.3, 4.3.
Yes, exactly.
Yeah,
5 cross-sectional level 5.2
Yeah. Sector.
and the 6.1.
Yes.
Yeah. 6.1.
That's all.
Yeah. Okay. Okay, colleagues, thank you. Thus, we have now finished the discussion of the draft conclusion of the dissertation work. And I propose to approve the conclusion and take it as a basis, yeah, taking into account the mentioned comments and suggestions. Any objections, please? I think no objections, and it's adopted unanimously, yeah. And thank you, everybody, and I thank everyone who joined us at the meeting, and a good day and a good luck to everyone.
Всем большое спасибо.